Half of all people going on Medicare plans today are selecting Advantage plans. In this video, I'm going to show you 7 reasons why people should select them and 7 reasons why you should not. Now, some of you are going to select Advantage plans to use your Medicare benefits, and that's a fit for many, many people. But I just want to make sure that those of you that take Advantage plans are doing so for the right reasons. Sometimes people find the advertisements appealing and all the things that are shared on TV, and the truth is there's another side to Advantage plan that are actually not shared in those advertisements. I call it kind of the dark side. And so what's most important is you understand the good of the Advantage and the bad and the fine print. And so for those of you that are considering an Advantage plan, let me tell you who I think should for sure get an Advantage plan. There's 7 different reasons. There's probably more than that, but 7 reasons that I want to share in this video why I think getting an Advantage plan would be in your best interest. So number 1, if your finances are very tight. Now, by the way, I didn't say your finances are tight. Most people that are in retirement are living with a limited income. But I mean they're very tight, which means, hey, you're just barely making anyways for your rent, your house payment, car payment, your food and your meds, all those kind of things, and it's very tight for you. I would not get a supplemental plan because, frankly, you couldn't afford one. You don't want to add that to your monthly budget, okay? Now, especially if you're on Medicaid. Anyone that qualifies for Medicaid is going to be eligible to even get help with their Part B premium, as well as some of their drug copays and other out-of-pocket expenses on Medicare. So again, if you're on Medicaid, I definitely would not get a supplemental plan. You can find what's called the dual SNP plan. That's a dual special needs plan, and you qualify for Medicare as well as Medicaid, and they have some special plans for you. But again, let's boil it down to this. If finances are very tight, do not get a supplemental plan, please, because you're probably not going to be able to keep that. It just doesn't fit in the budget. The second reason that I think you should get an Advantage plan is if you are fine with limited providers. And the reason for that is because all Advantage plans are network type plans. And so what we have is we have 2 types of networks. We have HMO and we have PPO. And if you're fine with these, and a lot of you have been covered by these when you were working, and so if you have an HMO network, you're going to find that, as you can see from my drawing here, it's kind of a little smaller of a box. There are going to be less providers in there, less doctors, less specialists, less hospitals to choose from. Now listen, that doesn't mean there's not enough to choose from and there's not plenty to choose from. It means there's going to be less, though, especially as we compare that to Advantage PPOs. Right? The Advantage PPO is going to be a larger network, and certainly not all doctors are going to take all these plans, but more doctors will take the PPO than the HMO. And the reason for that is because the doctors get reimbursed more money for the services they provide. The HMO contract does not pay them as much as the PPO contract, and that's why you have a larger network. And so you're going to have to be fine with these networks, because with networks come limitations. Now, if you do have an HMO plan, what you're going to find is that your copays are less than PPO. Your max out of pocket is going to be less on the HMO, and sometimes they throw in some additional benefits, maybe extra dental or extra vision benefits, and so they make those very attractive. But one of the issues is if you're on an HMO plan, OON stands for out of network. So you cannot go out of your network if you're on an HMO unless it's urgent care or an emergency room situation. So again, I'm going to cross that through because you don't have the option to go out of network unless urgent care or emergency room. People on the PPO plan can go out of their network. That's why some will select that, because they can go outside the network to anyone that takes Medicare. But you got to remember, if you're on a PPO and you go on a network, it's going to cost you substantially more. Your max out of pocket will be more, somewhere between $7,000 and $10,000 a year, and your copays are going to be more as well, many times 40% of the cost of the outpatient provider. Again, you have the flexibility, but it will cost you more. So my point is this: you should get an Advantage plan as long as you're fine with the networks, HMOs, PPOs, and limitations and restrictions that are going to be on that plan. Okay, now the third reason I would suggest you get one is because you come to a place where you're fine with the copays the plan's charging you, and you're fine with the max out of pocket. Now remember, there will be a few things that'll be a zero copay. You can usually see your primary care doctor, zero, get some labs for zero. They usually embed zero for like a gym membership. They They won't charge anything for your drug plan. You have to pay copays on the drugs, but the plan itself is zero. So there's a few things that are zero. But as a general rule, what you're doing is you're paying copays for everything that you do beyond a few zeros. You go to the hospital, it's usually about $300 to $350 a day. You have an MRI, then it will cost you maybe $200, $250 for the MRI. If we have an outpatient procedure, it may cost you $250 or $300 for that outpatient copay. So the point is we pay copay as we go. But those copays eventually will stop, and we call that the MOOP, the max out of pocket. And this is the annual amount that you'd have to pay. So again, copay, all apply to my max out of pocket. And those are going to range anywhere from about $4,000, I'd say $4,000 to maybe $7,000. If you go out of network, it's a little bit higher than that, but the point is $4,000 to $7,000, you pay your copays. Once we've reached that max out of pocket for the year, then you put your checkbook away, your wallet away, you're not going to have to pay anything. The plan covers 100% of all those expenses, and then what happens is those reset every January. So it's a copay plan until we hit the MOOP, and then we reset the MOOP every year in January and we start paying copays again. All right, so as long as you're fine with pay-as-you-go, and many of you would be because you had that with your group plans, then that would be fine for you to select the Advantage plan. The other reason that you should go with Advantage plan is if you're fine with what we call the embedded drug plan. Okay, now most Advantage plans are called MAPDs. And what that means, the MA is the Medicare Advantage side, which takes care of inpatient and outpatient services. The PD is that Part D prescription drug plan, all right? And so most of you are going to get an MAPD that get an Advantage plan. Now keep in mind, if you're a veteran, you get VA, or you're TRICARE for life, you're retired from the military, or you are retired civil service and have FEHB. Some of you could get what's called an MA only plan. And your plan does not include prescription drugs because you can get your medications through FEHB or TRICARE for Life or through the VA. And so you can get an MA only plan. But the rest of you, you're going to have an MAPD, an embedded drug plan. And so as long as you're fine with that embedded drug plan because you didn't pick it, they picked it, then it is all right to go with an Advantage plan. And so we tell people all the time, when we go with an Advantage plan, we have to check all your providers. We want to be comfortable with our copays and max out of pocket. And then thirdly, we've got to check those medications because we want to make sure that we have a good coverage for our medications at a good price. And frankly, some of the embedded drug plans with Advantage are very good, and some of those are kind of mediocre. And so you want to make sure your meds are going to be covered. So if you're fine with that embedded drug plan, it's fine to go with the Advantage plan. And then fifthly here, it's fine to go with the Advantage plan as long as you're comfortable with change. And the reason for that is because Advantage plans are only written for 1 year. 1 year, and that's it. It's a calendar year. And it's an agreement between Medicare, you, and the insurance company. And so what happens is Medicare says the insurance company, they can change those on an annual basis if they want to. They can add to the plan, they can take some benefits away, they can pull the plan, they only have to make it available. So it's an annual contract. And so if you're on an Advantage plan, you got to be comfortable with the fact that your plan can change. The networks change. We may find a doctor in network 1 year and not in network the next year. And so again, that can change. So it's very fluid. And if you're comfortable with change, no big deal. But one of the nice things about the Advantage plan, because they're only written for 1 year at a time, they do give the option to change. And those best dates to change are October 15th through December the 7th. And so we're on an Advantage plan and we don't like it, and we can change the next year. And so the way you'll know whether you like Advantage plans year to year is the Advantage plan every year has to send you what is called an ANOC. An ANOC. That is an annual notice of change. So let's say I'm on an Advantage plan in 2023, right around the 15th of October, that Advantage plan mails me a packet, and they're going to say, okay, here's the plan you're on, here's what we're going to offer you, and here's what we're changing for 2024. And if you look at the changes and you like the plan and the changes, and there's the doctor's still in network, your meds are still covered well, you don't have to do anything, it will automatically renew. But if the plan has changed something, or your docs have changed, meds have changed, then you have the right during October 15th, December 7th to get a new plan that will be effective January 1 of the next year. All right. And so again, if you're all right with change, an Advantage plan could be a very good fit for you. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. Now, sixthly, I want to talk about pre-authorizations, because if you take an Advantage plan, folks, you have got to be comfortable with pre-authorizations. And a pre-authorization means that you need some kind of a healthcare service, typically more on the expensive side, that has to be pre-approved by the insurance company that you're covered by. And so this simply means that if the doctor says you need an MRI or a CAT scan or a knee replacement or a hip replacement or something, skilled nursing stay, something that requires a pre-authorization, just because doc says you need it doesn't mean you're going to get that. Because why? Because the pre-authorization has to go to the insurance company. They have to agree with the doctor and they have to approve of that, or you're not going to get that service. And again, many times they'll approve those services, but sometimes they don't. Sometimes they delay coverage. Sometimes they flat out deny coverage. Had a lady recently that needed a knee replacement on the Advantage plan, and they would not pre-approve it. They wanted her to try shots to the knee first. After that, then they wanted her to go therapy. And then maybe after that, they would pay for the knee replacement. That's what happens when you're on an Advantage plan. And if you're fine with that, then you can go with an Advantage plan, okay? Because now you're just giving that insurance company some say-so in your health care, and if you're comfortable with that, that is fine. Now, I would tell you personally, this is one of the issues that I have with Advantage plans, and this is why I'm even teaching about this, because this can be problematic from time to time. I've had it happen with plenty of my clients, and so I want to read a report to you, and this comes right from the government. This report is public. You can find this easily from government records. Here's this report. They are reporting on Medicare Advantage plans, and it's talking about how Medicare Advantage plans wrongly deny care and physician payments. So this article was written April 29th, 2022. Listen to what they say. Medicare Advantage plans often denied medically necessary care to beneficiaries and payments to doctors that met Medicare coverage rules. So they said, we're not going to provide this care, even though Medicare said they should have. Let's keep going. They said 13% of prior authorization requests that were denied to the patient met Medicare coverage rules. In other words, that it should have been covered. That the type of care denied typically involved advanced imaging services, which would be CAT scans, MRIs, and PET scans, and also denies in stays in post-acute care facilities. This would be a skilled nursing facility after a hip replacement or maybe a stroke, and they were denying that kind of coverage. The report added that these plans denied these services and requests by using clinical criteria that are not contained in Medicare coverage rules. In other words, they were adding to the rules, and by that, those requests were being denied. Okay, and they go on to say, although Medicare Advantage plans approve the vast majority of requests for services and payments, they issue millions of denials each year, and CMS, in their annual audit of Advantage plans, have highlighted widespread and persistent problems related to inappropriate denials of services and payments. Concerns about these denials is growing as Medicare Advantage plans increase in the number of people on the plans. My last statement, this is very interesting. This came from the president of the American Medical Association. Here's what he said. Surveys of physicians have consistently found that excessive authorization controls required by health insurers, Advantage plans, are persistently responsible for serious harm when necessary medical care is delayed, denied, or disrupted. Because Medicare Advantage is a capitated payment model where companies are paid for a fixed amount per beneficiary. They get the same no matter how healthy or unhealthy you are. There's a potential incentive for insurance to deny access to services and payments in an attempt to increase their profits. And then lastly, commonly used methods for denying care include clinical criteria that we just talked about that are not in Medicare coverage rules, such as required an X-ray before approving more advanced imaging. So this has become a big problem now with Medicare Advantage plans. And so you have to be comfortable knowing that I'm going on a plan that is going to require pre-authorizations for certain services. And then the seventh reason I think you should get one is if you're fine with being on the Advantage plan permanently. And the reason for that is because what happens when you take an Advantage plan, and in some instances, you're actually given a year to try the Advantage plan. Not all instances for sure, but if you did have what's called a trial right to be on a Advantage plan, if you stay on that plan beyond that first year and you're on it 2 years, 3, 4, 5 years, if you ever want to get off that plan, now you have to medically qualify to pick up a supplemental plan. right? So that Advantage plan, if something, while you're on that, your health changes, maybe you have AFib or you get diabetes that's serious, or maybe you have rheumatoid arthritis or some issue going on that the supplemental company does not want to approve, then they can deny your application to get a supplemental plan, and you'll be on that Advantage plan for the rest of your life. And it doesn't mean that you're on bad insurance. It just simply means that now you're going to be in that Medicare Advantage system until you die, living with preauthorizations and networks and the changes and all those kinds of things. And so we want to make sure that you know you've got to be comfortable with the fact that it could be permanent if you cannot medically qualify to get off the plan. Now, I will tell you, there's 3 states where what I just said is an exception. Connecticut, Vermont, and New York have no requirements at all to get supplemental plans, so there's no underwriting, so you could do that at any time during the open enrollment season. But all the rest of the states, if you're going to get off that Advantage plan, been on it longer than a year, sometimes even less, now you got to medically qualify. But if you're comfortable, it's all right to go with the Advantage plan. So that's 7 reasons why I think you should get a plan. And again, some of you are going to fall in that criteria. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. Now let's talk about the 7 reasons why I think you should not get an Advantage plan. And these reasons you need to go through and really understand them. So who shouldn't get an Advantage plan, in my opinion? Well, number 1, if you have some serious pre-existing conditions right now, or maybe you're concerned about something because of maybe your health history or the health history of your family. And the reason for that is because what happens is you have this window of opportunity when you first go on Medicare where you can get a supplemental plan. And that is called the Medigap open enrollment period. So let me just draw it out for you. Let's say that I was going to start my Medicare A and B, and my eligibility was 1/1/2023, which means I'm just saying I'm going to turn 65 then or whatever. Maybe I'm going to retire then, but I'm going to be eligible for Medicare January 1st, 2023. You have this 6-month window, folks, where you can get any supplemental plan that is sold in your state. Now, most people today are either getting an F plan, a G plan, or an N plan. Okay, now the difference is the F plan is a full coverage plan. Now, if you get an F plan, you do have to be born before January 1st, 1955, therefore eligible for Medicare before January 1, 2020. So if your birthday's after that, you cannot get an F plan. And so the G plan is the one that most people are getting today. Again, if you're born after January 1st, 55, starting Medicare after January 1, 2020, then that would be a possibility for you to get a G plan. The G plan is not full coverage like the F, it's close. The G plan covers all the gaps that Medicare says you're responsible for, but one, and that is the B deductible. Okay, so the B deductible you would have to pay if I have a G plan. So once a year, whatever that B deductible is, that would be yours out of pocket. It covers all the rest of the gaps. This year, 2023, the B deductible is $226. Okay, and other than that, everything else would be covered. The plan below that's called the N plan, and the N plan pays 4 of the 6 gaps. So it's not as full coverage like the F, it's not as comprehensive as the G, but it's still a good covered plan. It covers all the gaps on the A, but on the B side, it does not cover the B deductible, and it doesn't cover excess charges. So if you happen to go to a doctor that adds to the bill, then you would have to pay that if you were on the N plan. And so what happens is people buy these supplemental plans to fill in the gaps that Medicare didn't pay. And so here's how you get to buy those. We have this 6-month window of once we start Medicare. So back to my example. If I start Medicare January 1, 2023, I have 6 months where I am in this Medigap open enrollment period where I can get any supplemental plan of my choice, any letter, any company that is sold in my state. Last 6 months. Okay, so that my 6 months in my example would be all of January, February, March, April, May, June. So those 6 months, I can have anything I want. There's no health questions asked. The insurance company has to take your pre-existing conditions. Even if you have something terrible, they still have to take it. But in my example, July 1, 2023, in most states, if you ever want to get off of that supplemental plan and get another one, you have to medically qualify. Or if you don't get one during the first 6 months, you want to pick up one later, now you're going to have to medically qualify to do that. And so that's what I'm saying. You should not get a Medicare Advantage plan if you have some serious health issues right now that are real serious, because then you may never ever get one of these Medigap policies because you have 6 months to get the plan. Now, practically speaking, I want you to know you actually can apply 3 months before your Medicare starts, but that 6-month window is 6 months from our B date. Very important time. So again, you shouldn't get an Advantage plan if you got some health issues you're really concerned about. Okay, the second reason I wouldn't get an Advantage plan is if you do not like financial surprises. Okay, what I mean by that? Well, in the Advantage system, we could have financial surprises. You're not anticipating going to the hospital, but if you do, your copayment could be $350 a day, maybe for 5 days. That's $1,750. That could be very surprising to people. If you get cancer, you probably will max out. Remember, I said max out is somewhere between about $4,000 to $7,000 in network. And if you get cancer and go through chemotherapy, radiation, maybe have a surgery, you will max out, and that would be a big financial surprise to you. That doesn't happen when you get supplemental plans. You don't have financial surprises. You pay a premium, and like I said earlier, if you go with that G plan, you got the B deductible once a year, and you're done. There will be no surprises financially when it comes to supplemental plans. Yeah, now will the rates go up? Sure. Or everything goes up. Medicare Advantage plans go up and max out of pockets, but that Advantage plan can raise the premium. But as far as the coverage, if you get the G plan, you'll never be surprised because that G plan will pay everything for the rest of your life other than the B deductible. Okay, so if you don't like surprises, wouldn't take an Advantage plan because that could happen to you. And then thirdly, I would say that you are fine not getting an Advantage plan if you have a little extra money in the monthly budget to be able to get a supplemental plan. So in other words, if finances are not real tight and you have ample funds to pay a premium for that supplemental plan, then I would not get an Advantage plan. Now, again, this is going all over the country, all 50 states, so plans are going to vary based upon where you are, your gender, your age, all that matters. But as a general rule, most G plans right now are going to go for about $125 to about $150 a month. Now, I'm fully aware there's some that are cheaper, fully aware there's some going to be more expensive. I'm just saying, generally speaking, we got a monthly premium of $125 to about $150 a month. Now, if you're married, stay with the same company, you'll get some kind of a discount off that. But the point is you pay a premium. And if that is not going to break the budget for you to get really what I would call Cadillac insurance, then I would not get an Advantage plan. I just would not. If you have that money and it's not going to hurt you to do that, then I would get a supplemental plan. Now, again, your supplemental plan is not going to come with any perks, a lot of additional benefits other than just great insurance. Most of them are going to give you a free gym membership or some dental benefit or a vision benefit allowance. I'm not going to do that. You're going to have to buy those things. But the point is, it is very, very good insurance. So if you can afford that monthly premium, then I would not get an Advantage plan. Okay, number 4. Now, when you are on a supplemental plan with original A and B, here's the way it looks. We got A and B, and let's just say we have G or N, whatever you get, F plan. You have to add a prescription drug plan. It is separate. It's a separate policy. So you should not get an Advantage plan if you want to be able to pick your drug plan. And we pick drug plans based upon what meds you take and the pharmacy that you would like to go to. And so in the Advantage world, they pick the drug plan for you. In this system, with the Med Sup plan, you pick your own drug plan. Could be separate from the supplemental plan. And you have a separate premium for that. So you got to be able to afford that. They range anywhere from $5, $7 a month upwards to $50 a month. Average is about $30 a month. But so again, you have to be able to afford that, but we have the flexibility of picking the plan that's going to give us the best coverage and the best cost. And the good news is every year, October 15th to December 7th, I can change my drug plan. I picked that plan, and if your meds have increased, you may want to get a nicer drug plan. If they decrease, maybe lower that drug plan, but we can change those on an annual basis. So again, if you want the flexibility of picking your own drug plan, then it is wise for you then not to go with the Advantage plan. All right, and then number 5, and to me this is a big deal because I wouldn't go with an Advantage plan if you want the flexibility of going to any provider that you choose. We've already seen on Advantage plans, we have HMO and PPO networks. They come with restrictions and limitations. If you take a supplemental plan, you don't have a network of providers at all. You can go to any provider, any hospital, any doctor, any specialist that takes original Medicare. They will take your supplemental plan. And the beauty behind this is 99% of all doctors take original Medicare. The great majority of hospitals take Medicare, and the specialty hospitals like Mayo Clinic and MD Anderson, those most places will take some Advantage plans, but not others. And so those specialty cancer centers and those hospitals may be off limits to you on Advantage, but not so in Original Medicare. As far as I know, I think they all will take Original Medicare, and therefore they'll take your supplemental plan to bill as second to Medicare. All right. And so again, if you don't want the limitations of a network, you want to go wherever you want to go. And really, I tell people all the time, let's say you live in Denver, Colorado, and you pull out your A and B card and your supplemental card. That service is the same whether you're in Denver, Colorado, or you're in Miami, Florida. The red, white, and blue card and the supplemental card, because there's no networks, as long as that hospital, that doctor takes Medicare, you can go anywhere that you want to. So if you don't want those restrictions, you don't want to go with the Advantage plan. And then number 6, if you're not in favor of pre-authorizations. And I've already talked a lot about this as I told you how they work. With Advantage plans, 72% of Advantage plans require pre-authorization. So if you don't want that insurance company to have a say-so in your healthcare services, then you probably are not going to want to go with Advantage plan. When you go to the supplemental plan, they have no say-so whatsoever, because Medicare Advantage plans follow Original Medicare. So if your doctor says you need this knee replacement or hip replacement or surgery or whatever, then Medicare says they'll cover it. Doctor says you need it. End of story. You go on the schedule. There's no questions asked. I recently had a lady that was on an Advantage plan, and she needed a knee replacement, and that's what the doctor recommended. But again, Advantage, so it had to be pre-approved. And the Advantage company flat denied it, and that's what we read that article about. They denied it, and they wanted her to have shots first in the knee, and then after that, rehab of the knee, and then they would consider the possibility of a knee replacement. That's what you have. That same lady, had she not been on the Advantage plan and had a supplemental plan and been on Original Medicare, a doc says you need it. Medicare says we'll cover it. End of story. The insurance company on that supplemental plan has no say-so whatsoever. If Medicare pays, the supplemental plan will absolutely pay. They're going to follow Medicare. Now, Medicare doesn't pay, your supp plan's not going to pay either. But the whole point is this: we don't have pre-authorizations. And so if you don't want the insurance company to have a say-so in some of your healthcare services, then you probably are not going to want to go with the Advantage plan. If you want you and the doctor to make those decisions, then you're probably safer than in Original Medicare with a supplemental plan. And then last, I'll close this out. I would recommend not going with the Advantage plan if you don't like change. Okay, because Advantage plans have changed. We've talked about that. They can change every year. Networks change. The plans change. They improve. They get worse, whatever. But when you have a supplemental plan, if you have that G plan, you pay the B deductible once a year. If you have the N plan, you pay the B deductible, some copays to see the doctor, and all excess charges. But again, you know exactly what you're going to get, because those plans cannot change. The only thing they can do, they can raise the premium, and they will. Everything goes up because of medical inflation. But that plan is written for life. Whatever company you go with, whatever plan, it's written for life. They cannot cancel it because of lots of claims. They cannot cancel it because you move from, let's say, Denver to Dallas, Texas. You take the plan with you because, again, it's a lifetime policy, totally portable. You can take that wherever you want. And they can't change that policy for any reason other than non-payment of premium. That's the only way. So if you want something that's going to be fixed for the rest of your life, that supplemental plan probably would be your better option and not the Advantage plan. All right, so I've shared a lot with you. I hope it's been helpful. Folks, it all boils down to this. When you go on Medicare, you're going to have to pick one of these two systems. And those two systems have one thing in common. Either way I go, whether that's an Advantage plan or a supplemental plan, I'm enrolled in Medicare A and B. I got to pay my B premium, right? But beyond that, these systems are totally different. And so you have to look at the details of these two systems and decide what you're going to be comfortable with. So I hope these 7 reasons why I would get an Advantage plan and 7 why I would not have been very helpful. Thanks for watching.